Thank you, Madam Speaker. I'm proud to rise in support of this amendment. I thank my friend from the 25th. I echo the comments that have been made about the importance of our Medicaid system and the people that it serves. Madam Speaker, on average in Washington, we are reimbursing Medicaid at 57% of the rate of Medicare. I'll just repeat that one more time. On average, Washington State is reimbursing Medicaid at 57% the rate of Medicare. Washington State is number 48 in the country for low Medicaid reimbursement rates. We are only behind New Jersey and Rhode Island. Healthcare professionals that are serving patients in our neighboring states, by virtue of serving those states, are receiving higher reimbursements than they receive in Washington. Madam Speaker, from 2012 to 2023, we saw an increase in our Medicaid patients from 1.2 million to 2.1 million, a 90% increase in patients who rely on our Apple Health system, our Medicaid system here in Washington State. And that is why, along with the ranking member of the Appropriations Committee and Healthcare Committee, I introduced a bill this year to fund Medicaid at the full Medicare rate. But my friend from the 43rd, who referenced another policy on that line, unlike that policy proposal, this policy proposal funds Medicaid using existing revenues. As we in the state of Washington see billions of dollars in revenue surplus, it is possible, Madam Speaker, to prioritize what the government is spending its money on and to fund the programs that people rely on. It is becoming impossible, Madam Speaker, for people of limited financial means to achieve equitable health care that is accessible to so many others of their neighbors. This is a crucial priority of government. And we're hearing from our doctors and our healthcare providers on this issue. I was really interested in an article that was put forward by the Washington State Medical Association just a few months ago. Permission to read.
Please proceed.
It begins by talking about a Dr. Kim who practices ear, nose, and throat medicine in Thurston County. And Dr. Kim said, it is a priority of their practice to not pick and choose, but to serve all patients, regardless of their funding source. But, as this article says, now Dr. Kim finds himself in an ethical quandary. Because of the low reimbursement rates for Medicaid, it's not economically feasible to be so open to all patients. We lose money on our Medicaid patients, he says. We just can't sustain it anymore. In 2023, the practice dropped accepting one Medicaid plan. In 2024, the practice is taking even more drastic steps. We unfortunately are going to limit the remaining Medicaid patients over 18 to just 1 day, Dr. Kim says. That means the first appointments are 9 months out right now. We'll see the cancers and the urgent things, but everyone else will have to wait or go to Seattle or Tacoma. It puts 3 highly productive surgeons out of the pool, and there aren't that many ear, nose, and throat specialists in the state to begin with. The toll the decision is taking on Dr. Kim is noticeable. I feel terrible about this, he says. I'm losing sleep over it. He's hardly alone in dealing with the pressures from low Medicaid reimbursement rates. Specialists in Washington are reeling from a reimbursement system that has remained unchanged for decades, even though the number of Medicaid patients in the state has nearly doubled. The low rates effectively penalize them financially for treating Medicaid patients. And this, Madam Speaker, the result is that access to care for Medicaid patients is increasingly hard to come by. Madam Speaker, this amendment gets to the heart of something very important, crucial, very basic for the lives of people in our state who have limited means. Equitable access to doctors, equitable access to care, equitable access to quality of care. The state of Washington holds itself out under the Medicaid system and says, we will provide a health care plan for you who may not be able to have a private insurance plan. We hold this option out. And then the result is no doctors, no appointments, 9 months waiting for care. Let this be the moment, Madam Speaker, that the state of Washington funds Medicaid equitably, using existing revenues on an ongoing basis. Let this be the moment that the people of the state of Washington who rely on these social services can say with confidence, we will receive what we have been promised. Please vote yes.